Hi, young man. Would you tell me your name, please?
My name's Conan Mastrangelo. I'm 30 years old. I live in Los Angeles, California. And I completed 7 weeks of spinal decompression therapy in December 2010.
Okay. And what was it that actually brought you in? What was the area of the spine that you had the problem?
It was I had a herniated disc, C6, C7 on my neck.
I see. And it was a big one, wasn't it?
What was it? 8 by 12? 7 by 12?
It was 7 by 12 by 22 millimeters.
7 by 12 by 22.
Yeah. That's a biggie. That's like having a kidney bean in the middle of your spinal
It didn't look
canal.
pleasant.
Yeah. And what was the effects of having such a herniation? What were you experiencing?
I had severe pain while sitting. And if I had to do anything with my arm too long, with my right arm especially, and I had a pretty bad. I lost about, I don't want to say like 50 to 60% of the use of my tricep and my right arm.
Yeah.
I lost a lot of strength.
You're a pretty athletic guy, right?
Yes.
Yeah. What kind of physical activities do you engage in?
I participate in mixed martial arts and in CrossFit training.
Okay. Yeah. So you're a pretty active guy, and it was like even tough to do a push-up, as I recall.
I went from easily being able to rip off anywhere from 30 to 50 push-ups to 1.
Wow. Okay. And so, how was it you found Dr. Shannahoff and Valley Spinal Decompression Center?
I was going to see a chiropractor in North Hollywood, and when I had this injury happen, she recommended to me that instead of surgery, I go do spinal decompression therapy. She sent you an email.
Yes.
Dr. Summers, and then I made an appointment. I came, and I took the plunge.
Yeah.
Dr. Shannahoff.
Yeah.
Says.
And what was your experience like in the office as far as the treatments? Was it painful? Was it comfortable?
You definitely have to put in work, but it's a pretty non-invasive treatment.
Yeah.
You need like an hour, 1 hour, 4 hours a week. 4 days a week, 1 hour. It's not. It takes some getting used to, but there was no pain.
Yeah.
And very little soreness. Just by about week 3, it just felt like show up to the office, sit down, go through the routine.
It was your normal routine
at
that point. And about that point, wasn't that where you'd had another nerve conduction study with your neurologist?
I went to see my neurologist for a follow-up. I had the nerve conduction study finally, and he said that from my original injury and what he saw in the MRI and for what my strength tests were from that nerve deficit, he said that with those readings that I should stick with the conservative treatment. He had no problem with me sticking with the conservative treatment.
So he saw things getting better, and
a lot better.
You felt like
I felt
they were getting better. Yeah. And in the end, you got a post MRI, right?
I did.
And that came out looking pretty slick, didn't it?
What is the MRI tech said what, a 2 millimeter protrusion?
The medical radiologist said that there was maybe 2 millimeters left of a bulge, but the spinal cord was now clear of any
obstructions.
It
doesn't even look like I was injured.
Yeah.
Doesn't even look like I was injured.
Yeah. That's pretty sweet, isn't it?
I'm pretty psyched about it.
Yeah. So those people at Valley Spinal Decompression Center, did they take good care of you?
Absolutely.
Yeah.
I would recommend this to anybody. I have recommended it before.
Yeah.
I've recommended it to several people.
Yeah.
And that's I tell people, like, you don't have to do surgery.
Yeah.
You can come here or to any spinal decompression. I mean, this is where it is. This is the future, as far as I'm concerned.
Yeah.
I went from, my neurologist guaranteed me that I would need surgery.
Yeah.
Called me at 8 o'clock at night as soon as he got the MRI results to tell me that whatever I was doing, stop, and that I needed to get in to see a neurosurgeon as quick as possible.
Yeah.
That I was going to have, if I didn't have this taken care of soon, I was going to have serious nerve problems for the rest of my life.
Yeah, and of course, there was a bit of a problem with insurance, covering non-surgical spinal decompression. How did you feel about that?
I'll tell you, Dr. Summers really sold me on this, and she was the one who figured out what the problem was originally. And I figured I was just, if you get someone good, you stick with them, you listen to their advice, and that's what I did. I took, insurance doesn't cover it, but it was worth it.
Yeah.
That doesn't make any sense. That insurance would say, we're going to drill a hole in your neck, cut out a section of your spine, and then bolt it together.
Yeah.
We'll take care of that. But if you just want to do, some therapeutic stretching and oxygen therapy, no way. Not going to pay for it.
Yeah. Yeah. Well, I guess you really do owe a debt of gratitude to Dr. Summers. That was a good call on her.
That's the phone call I'm making tomorrow. That was a great call. And Valley Decompression Center. I told Natalie about this.
Yeah.
I told another working coworker about this when she hurt her neck. I've told friends who've hurt their back.
Yeah.
That this is the way to go.
Well, as always, we appreciate you spreading the word.
Absolutely.
Okay. Thank you, Conan.
Yeah, thank you.
Yeah.